and I'll have you read through those, but there's several there, so 2 pages of learning objectives. So let's start out with what is the difference between ethical and unethical research. So ethical studies protect subjects and are carried out using scientific principles, while unethical research includes these areas: scientific misconduct, fraud, violations of a research protocol, fabrication, falsification, forging of data, plagiarism, and putting subjects at risk without consent. The elements of ethical research are protecting human rights, understanding informed consent, understanding institutional review of research, and balancing benefits and risks in a study. What are a few examples of unethical studies? The Nazi medical experiments. Between 1933 and 1945, in Nazi Germany, unethical researchers used Jewish prisoners in concentration camps to conduct experiments on sterilization, euthanasia, surgical procedures, exposing the prisoners to harm. The Tuskegee syphilis study you may be familiar with. African American men were not informed of the purpose or the procedures of the study. This was between 1932 and 1972, so that's 40 years. They were never treated with penicillin, and many died from the ultimate sequelae or the complications of syphilis. The Willowbrook study in 1950 to 1970, so 20 years. Willowbrook was an institution in Staten Island, New York, for severely mentally impaired patients, mainly children. So this physician, Saul Krugman, experimented by giving hepatitis virus to the children who were severely retarded. To be admitted to this hospital, parents had to give permission for the children to be in the study, or they wouldn't be accepted as a patient. And the Jewish Chronic Disease Hospital, this was 1960, this was an unethical study where, you won't believe this, live cancer cells were injected to patients. No informed consent, no IRB approval, great potential to harm patients. Their rights were not protected. So there was an effort to protect patients from the harms of research. The first attempt was in 1949, the Nuremberg Codes. And I'm going to direct you to the textbook, chapter 4, box 4-1. Yeah. So this is gives you an idea of what protection HIPAA Privacy Law, Department of Health and Human Services, and the U.S. FDA. So the first one, the Nuremberg Code, 1949, the code was developed when during the Nuremberg tribunals, they became aware of the unethical research, and there was international attention given. So the Nuremberg Codes, the guidelines in box 4-1 talks about voluntary consent of the human subject is absolutely essential. Okay. The declaration of the Nuremberg Code focused on voluntary consent, protecting subjects from harm, and they introduced the concept of risks versus benefits. All right. The Declaration of Helsinki in 1964. This declaration focused on a distinction between therapeutic research and non-therapeutic research. And we'll talk about that in a little bit more detail a little later. The Department of Health and Education and Welfare Regulations of 1973, they developed and proposed federal regulations for the protection of human subjects, informed consent, and IRB process. In these regulations, there was great discussion of informed consent and the institutional review board process. The National Commission for the Protection of Human Subjects of Biomedical and Behavioral Research in 1978. This established the National Commission for the Protection of Human Subjects of Biomedical and Behavioral Research. They established guidelines based on ethical principles. So here's a question for you. A researcher who does not disclose that a portion of the data from the original study sample was not used in the final data analysis could be accused of which of the following? Infidelity, lack of scientific objectivity, plagiarism, or scientific misconduct? D. D is the answer. What is the Declaration of Helsinki? As I said before, the Declaration distinguished between therapeutic research and non-therapeutic research. In therapeutic research, the results might benefit participants. In non-therapeutic research, the results are not of benefits to participants, but might be in the future to other persons. What ethical principles are addressed in the National Commission for the Protection of Human Subjects Guidelines? So there are three ethical principles. Principle of respect for the person, the principle of beneficence, the principle of justice. These may be seen in the Belmont report, and here is the URL for you I want you to look that up. You should remember the Belmont report that made it clear what ethical principles research needed to include. A nurse researcher is conducting an outcomes research study and would like to focus on patient care. Which outcome would be most valuable to examine? Assessment, care planning, interventions, evaluation. Outcomes research focuses on end results or the evaluation component of the nursing care process. So D is the correct answer. What is the principle of respect for persons? Self-determination. participation, and withdrawing. This is the person is treated and is considered and treated as autonomous, meaning that they can make up their own mind. They can make up their own mind to participate, and they are free to participate, and they are also free to withdraw at any point. At will. The principle of respect calls for no coercion, voluntary consent, full disclosure, no deception, and persons with diminished autonomy have special protections. Children are considered diminished autonomy. Other examples of people who require special protections are the terminally ill, mentally ill, and prisoners. Now, for someone who is incompetent or comatose, this requires a legally authorized person to give consent for them. The voluntary consent of the human subject is absolutely essential. And this is made clear by the HIPAA Privacy Rule, the U.S. Department of Health and Human Services regulations, and the United States FDA Protection of Human Subjects regulations. What is the principle of beneficence? So, word beneficence comes from bene, and bene in Latin means good. So beneficence means do good, and above all, do no harm. So research should be, if we're employing the principle of beneficence, we want freedom from harm, freedom from exploitation, and consideration of risk and benefit ratios. The principle of justice. Justice requires fairness, fair treatment. And a person still requires fair treatment even if that person chooses not to participate. There should be no penalty for not participating in the study. Now, the right to privacy. There are two aspects to this. Anonymity and confidentiality. So in anonymity, the identity of the subjects cannot be linked with his or her responses. Usually the researcher knows the identity of the subjects, but they keep the identity anonymous from others, and the research data is kept confidential. So the second aspect is confidentiality. The researcher must ensure that the data shared by the subjects are kept private by safe management of data. A breach of confidentiality occurs when the researcher, either by accident or direct action, lets an unauthorized person gain access to data that is not de-identified. Title 45, Part 46, Protection of Human Subjects. Additional protection for pregnant women is necessary for human fetuses, neonates, children, and prisoners. Special documentation of informed consent. They must go through the IRB process and follow the Department of Health and Human Services regulations. Additional government protections. The FDA has regulations regarding clinical investigations when human subjects involve products or devices. So, for example, some company develops some product and they want to sell it. It has to be cleared and get FDA approval. Animal studies are also included, and animals are rarely used in nursing studies, but they apparently have been used in nursing studies, and every effort has to be maintained for the safe care and protection of animals. Clinical trials for drug investigations also have to comply with FDA regulations. What is the Health Insurance Portability and Accountability Act, HIPAA? I think you're probably very familiar with this. You know, it was implemented in 2003 to protect individuals' private health information. HIPAA privacy rules are very strict, and it affects research studies by requiring patient consent to use their private health information in a study. For example, I couldn't just go to the record room, okay, and start pulling charts and start getting data, okay? So we have to have consent to look at patients' information. What are the 5 human rights? Here they are: the right to self-determination, right to privacy, to anonymity and confidentiality, to fair treatment, and to protection from discomfort and harm. I urge you to look at page 110 in your textbook that gives you guidelines for examining the protection of human rights. And you can start using those when you start critiquing studies. How would you define self-determination? Humans are autonomous agents with the freedom to conduct their lives as they choose. And this principle is violated by any form of coercion, forcing someone to be in a study, putting pressure on someone to be in a study. Remember, if the individual does not wish to participate, there can be no harm to that person. There can be no penalty for not participating. The principle of self-determination would be violated if subjects are unaware that the study is taking place. And the principle of self-determination would be violated if there's deception, that is, misinforming subjects about the study, not giving them complete information. So what groups are included as people with diminished autonomy? Those who are legally and mentally incompetent, neonates and children, terminally ill subjects, people confined to an institution, and pregnant women and fetuses. Right to privacy. Right to privacy is the freedom that an individual has to determine the time, extent, and general circumstances under which private information will be shared or withheld from others. The HIPAA Privacy Rule protects individually identifiable health information. Now, this term de-identifying. De-identifying protected health information is allowed only if the following are removed: their names, geographic information, dates, phone numbers, fax, emails, social security numbers, medical record numbers, any certificate numbers, vehicle identifiers, device identifiers, URLs, IP addresses, fingerprints, voice prints, full face photos, all identifying numbers. Okay. De-identified information means that the subject cannot be identified. The data that they have shared cannot be traced back to them. All right, the nurse researcher is involved in selecting a sample for an outcomes research study on staffing ratios. Which of the following is a generally accepted guideline to follow? Specific patients are represented, heterogeneous samples are preferred, random sampling is very desirable, small samples are needed. Okay, the correct answer is B. Heterogeneous samples are preferred. They represent a wider population, and the researcher would want to interview or survey as many staff as possible to ensure that all are representative. The heterogeneous sample can then be generalizable. Data use agreement. This must be included in the consent. Covered entities: healthcare providers, healthcare plans, employers, and healthcare clearinghouses. The right to anonymity and confidentiality. In confidentiality, the researcher refrains from sharing information with others. A breach of confidentiality, unauthorized access occurs. Unauthorized access to raw data occurs. And anonymity, no one, not even the researcher, knows the identity of the subjects, that if it is anonymous. The right to fair treatment. Fair treatment is based on the principle of justice. Selection of subjects and their treatment during the study are fair for all. This is an important point. When you are reading a study, and in this course you will be critiquing studies, reading the actual article, the research report needs to indicate the selection of the subjects, how this was done, and their treatment during the study, that both of these were fair, and not because subjects were easily available, easily manipulated, or because the researcher likes the subject and wanted them in the study. The principle of justice and fair treatment prevents coercion of subjects. For example, paying subjects large amounts of money to participate. So injustices in the past occurred with regard to social, cultural, racial, and sexual biases. This is why random sampling is so important. Randomness in selection is one way to make sure that there is fair treatment of participants. Everyone has an equal opportunity to participate. The right to protection from discomfort and harm. This principle is based on the principle, this right is based on the principle of beneficence. Harm is considered in a variety of ways. There may be no anticipated effects on the participants, and that might occur if there are it's just a review of patient records. Temporary discomfort. Some discomfort might occur if you've asked someone to fill out a questionnaire. Unusual levels of temporary discomfort. For example, having a study that confines a patient to bed for 7 days to study the effects of immobilization. Or patients asked to relive painful events in their life. Unusual levels of temporary discomfort. Actually, that would be asking someone to relive painful events in their life. Now, risk of permanent damage. A study that has to do with administering new drugs or new surgical procedure. And the last one, certainty of permanent damage. Such studies should not be conducted. There are 4 elements of informed consent. Essential information for consent is disclosed to the participant. Comprehension of consent information by the participant is determined. There's competence to give consent among the participants. And voluntary consent is given to participate in the study. I urge you to use these elements when you are examining a research report for how informed consent was obtained and documented in the report. So, was essential information conveyed? Was there an attempt to determine the comprehension of the consent information by the participant? Was the person competent to give consent, and was it voluntary? What is included in the essential information for consent? Introduction of research activities. The researcher would ask someone to participate in the study. Statement of the research purpose. Selection of research subjects. The researcher might explain to the subject why they're being asked to participate. Explanation of procedures. Description of risks and discomforts. And the risks and discomforts fall under physical, emotional, social, economic, and benefit might be a financial reward or a stipend that's given for participating in a study. Disclosure of alternative procedures, if any, and assurance of anonymity and confidentiality. The researcher offers to answer questions. They make it clear that there's voluntary participation, that the participation statement indicates that their participation is voluntary, and refusal will involve no penalty. They have an option to withdraw at any time without penalty or loss of benefit to which they are entitled. And they consent to complete disclosure. Consent to incomplete disclosure if certain information must be withheld. What is an IRB, Institutional Review Board? In 1974, the National Research Act required a research study review all nationally funded research. Who serves on the board? They have 5 members with different backgrounds. They like to have a variety of cultural, economic, educational, gender, and racial background in order to be fair. The review, what they do is they review proposed research to make sure it is conducted ethically and safely before granting approval to begin the study. So their function is protect rights and welfare of subjects, make sure that there's voluntary informed consent, and that the benefits exceed risks. This is a flow chart balancing benefits and risks for a study. So if the benefits are greater than or equal to the risks, the study will be approved. If the risks outweigh the benefits, the study would be rejected. Institutional Review Board. All research proposals submitted for funding for federal or private institutions by individuals, members of academic or healthcare community, are reviewed by an IRB for approval prior to conducting any research. So once the proposal is submitted to the IRB, the researcher has to wait to receive official letter or notice of IRB approval to begin the study. There are different types of reviews that are conducted. Exempt from review. The procedures something would be exempt from a review if there's no risk involved. An expedited review, there's minimal risk, and a complete institutional review procedures are done for reviewing studies that are using vulnerable populations or have greater than minimal risk. So what are the categories of exempt research? Exempt from review study uses data that has already been collected and de-identified. Examples would be research on regular educational strategies. Data are recorded so that subjects cannot be identified. Existing data can be collected if no subject identifiers are present. Studies about public benefit programs, taste and food quality evaluation. What categories are associated with expedited research? Expedited review study is one that poses no more than minimal risks to subjects. Collection of hair, nails, teeth, dental plaque, excreta, external secretions, recordings using non-invasive procedures and study of existing data, collection of blood samples from subjects in good health, moderate exercise by healthy volunteers, research on behavior without stress, and research on drugs that are exempt from new drug investigation. What requires a complete review by the IRB? A complete review of by the IRB is required when more than minimal risk is present in the study. The focus has to be on the safety and the subject's rights. Student and faculty researchers must obtain IRB approval at both the university and the hospital level. In addition, researchers using multi-site research, multiple sites for collecting data, must obtain approval at all sites. What influences are associated with the HIPAA Privacy Rule on IRB boards? HIPAA must be followed. The report has to be read very carefully. The IRB panel must think about the procedures that were implemented, consider how the data were collected, were the patients put at undue risk, what is the risk-benefit ratio. Critiquing the ethics of a study. Some of the things that you want to consider are, was the study approved by the appropriate IRB? So look for that in the study. Was informed consent obtained from the subjects? If the subject is incompetent, did legally authorized representative give consent? Were rights protected during sampling and data collection and analyses? Was privacy protected during the study and in the final report? Was benefit-risk ratio of the study acceptable? Okay, so what we've covered this afternoon is taking a look at the ethics involved in nursing research. And at this point, you are a consumer of nursing research. You are reading it, and you may start making an effort to implement some of the findings of the research. but you always want to make sure that the study that you are supporting has good ethical practice. All right. Thank you very much.